Welcome back, students, to Part 19 of the Decode Healthcare Explainer. I am so thrilled to have you here today. Let's be real, if you've been looking at the medical billing and coding landscape lately, it probably looks a bit like an absolute alphabet soup of acronyms, right? Well, today we are going to decode that soup together. We're looking squarely at the main certification exams standing between you and your new career. Think of me as your personal guide and mentor for the next few minutes. We're going to break down exactly what these exams look like, what they'll demand of you, and how you can position yourself for absolute success. Okay, let's dive into this. Here is our roadmap for today. We'll be breaking down the CPC exam, the CCS exam, the CCA exam, and finally, we'll wrap things up with some crucial exam day guidelines. Section 1, CPC exam breakdown, the AAPC standard. Okay, take a deep breath. 340. That is 340 minutes, which translates to 5 hours and 40 minutes allotted for the CPC exam. This is the absolute pinnacle if your dream is to work in a physician's office or handle outpatient services. I want to bring this massive number up right away because you really need to understand that this exam is a marathon. It's a true test of your endurance, literally just as much as it is a test of your medical knowledge. You're going to be sitting there for a very long time, so mental stamina has to be a huge part of your preparation strategy. During those 340 minutes, you're going to face exactly 150 multiple-choice questions. It is a massive scope covering everything from anatomy and body systems to radiology, laboratory, and pathology coding. You'll be tested on evaluation and management guidelines, diagnosis coding, and the proper use of CPT, HCPCS, and ICD codes, plus coding standards and modifiers. Now, don't let this overwhelm you. I promise that a solid structured study plan covering these exact topics is going to get you ready. Plus, the AAPC actually provides study materials and practice exams created by the exact same people who write the real test, which is a huge advantage. Let's talk about the financial investment. Taking the CPC exam costs $300, which is not exactly pocket change, especially on a student budget. But here's the great news. If you're enrolled in an AAPC-accredited program, you get a discounted rate of $260. And honestly, even better, the AAPC provides a safety net. If you happen to fail the exam on your first try, you are given one free retake. It's incredibly comforting to know that you won't have to fork over another $300 if things just don't go perfectly the first time around. After you endure that marathon, the waiting game begins. The good news is, it's a pretty short wait. Your CPC exam results will be accessible online just 5 to 7 days after the proctor submits them. Then, about 2 weeks later, you'll receive your official hard copies in the mail. Oh, and one very quick important note from the source material here, you absolutely cannot get your results over the phone. So don't drive yourself crazy calling the AAPC, just keep refreshing that online portal. Section 2, CCS exam breakdown. The HIMA Hospital Expert. All right, we're shifting gears over to HIMA, the American Health Information Management Association. Specifically, we're looking at their Correct Coding Specialist, or CCS, exam. Now, unlike the CPC, the CCS comes with some pretty strict foundational requirements. You must absolutely hold a high school diploma or a GED to take this test. Furthermore, HIMA strongly recommends, though they don't strictly require it, that you have a minimum of 3 years of experience coding in a hospital environment before even attempting this. Why? Well, because as a CCS, you're extracting highly complex data from patient records involving detailed pharmacology and advanced disease processes. Your codes heavily influence hospital reimbursement and even public health data, so they really want you to be deeply experienced. So the crucial point here is how this test is structured, because it's vastly different from the CPC. You've got 4 hours to answer 81 questions. And here is the kicker, guys. There are absolutely no breaks allowed. None. The source text explicitly advises to cut down on the coffee and schedule some time to use the potty before entering the examination room. And they mean it. Also, it's not just multiple choice. This exam features a fill-in-the-blank section where you have to manually provide answers to real medical record case studies. It is a rigorous, highly practical exam. Keep in mind that 18 of those 81 questions are actually unscored pretest questions used for future test development. But you won't know which ones they are, so you have to treat them all as real. Let's talk budgeting for the CCS. AHIMA clearly rewards its members. The exam fee is $299 if you're a member, but it jumps up to $399 if you're a non-member. This instantly saves you $100 on the exam, which easily justifies joining AHIMA before you even register for the test. Section 3, CCA exam breakdown. The entry-level generalist. What if you want to work for a HIMA, but you don't quite have those 3 years of hospital experience yet? Well, enter the CCA. This is defined as an entry-level generalist certification. And what makes this credential so unique and valuable is that it demonstrates your proficiency across both facility environments, like hospitals, and physician-based settings, like doctor's offices. It proves you have the foundational skills to accurately abstract diagnostic and procedural codes, no matter what kind of healthcare door you walk through. Because it is entry-level, the prerequisites are much more accessible. You still strictly need that high school diploma or GED for sure. However, instead of 3 years of experience, a HEMA only recommends a minimum of 6 months working in a healthcare facility. And if you're brand new and lack that 6 months of experience, no problem at all. You can qualify simply by demonstrating that you've completed a formal medical coding instruction program. Looking at the costs for the CCA, we see a very similar pricing structure to the CCS, just at a slightly lower tier. It'll run you $199 if you're an HEMA member and $299 for non-members. Again, it is crucial to factor these fees and the potential membership savings into your educational budget early on. Section 4, Exam Day Guidelines, Your Survival Guide. All right, we've covered what exams you'll be taking. Now I'm putting on my coach's hat. We need to talk about how you will take them. Test day is high stakes. The proctors are incredibly strict, and you cannot afford to get disqualified over a silly mistake. We need to talk about the strict boundaries of the testing center. You are allowed to bring your authorized CPT and ICD reference books, but the proctors will inspect them carefully. Personal highlighting is totally fine, but you cannot have definitions written in your book. For example, if you wrote measles, mumps, rubella next to the letters MMR, you're going to be forced to remove it or use a blank book provided by the proctor. Prohibited items include any coding software, handbags, food, beverages, smartphones, calculators, Post-it notes, or loose leaf paper. They do not mess around with test security. Please do not be the student who studies for months only to get turned away at the front door. You are required to bring 2 forms of signed identification, and at least one of them must contain a photo. Acceptable forms include your driver's license, passport, military ID, social security card, or even a signed credit or debit card. Just do yourself a favor and double-check your wallet the night before the exam. I want to end our guidelines section on a serious note, just to emphasize the stakes here, particularly for the AIHMA exams. If things don't go your way and you fail an AIHMA exam, you're hit with a mandatory 91-day waiting period before you are even allowed to ask for a retest. 91 days. Not only that, but you have to repeat the entire application process and pay the full exam fee all over again. Preparation is literally everything. So what does this all mean? We've decoded the CPC, the CCS, and the CCA. You've seen the time commitments, the costs, and the rigorous standards. The question isn't just which exam you'll take, it's what kind of impact you want to make on the healthcare system. Will you be the physician's trusted expert or the hospital's data master? The choice is absolutely yours. Please like, share, and subscribe to Decode Healthcare with Harshal.